Good afternoon. I'm Mandy Cohen. I'm the Secretary of the Department of Health and Human Services for North Carolina. And with me today is Monica McGee and David Payne, our American Sign Language interpreters, and Jasmine Matevier and Ron Vasquez are our Spanish interpreters. As far as today's numbers, as of this morning, there were 5,637 new cases reported today. 2,101 people are currently hospitalized, and sadly, there have been 5,410 deaths. Today, we hit another devastating milestone, going well beyond 5,000 new cases reported in just 24 hours. This number is alarming. Yesterday, we saw our highest rate yet of the percent of tests that were positive, hitting 11.4%. Our hospitalization numbers are also setting records with now over 2,100 people in the hospital with COVID-19. I am very worried. I know this is a particularly hard time of year to stay home and away from family and friends, yet it is the best way we can take personal responsibility and show our care for them as we fight this global pandemic. Earlier this week, I shared that in just 11 months, COVID has killed more than 3 times the number of North Carolinians as the flu did in the past decade. We must keep working together to protect our loved ones, to make sure our hospitals are there for those who need them, and to save lives. If you are with someone you don't live with, wear a mask and keep your distance. Better yet, limit your social actions as much as possible. We need to stay strong and strong together. If you attended a Thanksgiving gathering, please go get tested. Social gatherings can quickly become virus-spreading events, putting those who attended and the larger community at risk. We are so close to having the means to control this virus with a safe and effective vaccine. The Food and Drug Administration and their external advisory committee will review 2 vaccines this month. I'm going to take some time today to provide more details about vaccines, both how we got here and what will likely happen in the coming weeks. Although vaccines were developed quickly over the course of this year, corners were not cut. The vaccines were built upon years of work in developing vaccines for similar viruses, such as SARS. In addition, billions of dollars have been invested to allow clinical trials to proceed without delay and ensure manufacturing of those millions of doses of vaccines were happening at the same time. All of this allowed for our scientific community to shorten the time in getting us a safe and effective vaccine, so no corners cut. For the Pfizer and Moderna vaccine, more than 70,000 people combined participated in clinical trials to see if the vaccines are safe and if they can effectively prevent someone from getting COVID-19. Both companies worked to recruit people from historically marginalized populations to participate in those trials. For the Pfizer trial, 41% of their participants were non-white, including 26% who were Hispanic Latinx and 10% who were Black. For the Moderna vaccine, 37% of the participants were non-white, including 29% who were Hispanic Latinx and 10% who were Black. The people who make the decisions about whether or not to authorize the use of these new vaccines are FDA scientists, and they're career scientists, not political appointees. The data is also reviewed by another independent body. They're called the Vaccine and Related Products Advisory Committee. This committee works with the FDA to determine safety and effectiveness. The process is independent and it's transparent. Looking at the vaccines themselves, it's important for people to understand there is no COVID-19 virus in the vaccine itself. The vaccine imitates the infection so that our bodies think a germ like the virus or COVID is attacking. And this creates the antibody defenses we need to fight off COVID if and when the real germ attacks. Once a vaccine is authorized by use by the FDA, supplies will be very limited at first. Independent federal and state groups of experts have determined that the best way to fight COVID is to start vaccinating first those who are at most risk. Therefore, the initial supply of vaccines will go to a limited number of hospitals to vaccinate healthcare workers at high risk of exposure to COVID-19, those who are directly caring for or cleaning areas used by patients with COVID-19. Because of the limited initial vaccine supply, not all hospitals are going to even receive vaccine initially. But as more vaccine becomes available, it will be distributed to more of our state's hospitals and then to our local health departments to focus on vaccinating high-risk healthcare workers. Long-term care staff and residents will also be in the first group to receive the vaccine. Vaccinations at skilled nursing facilities and adult care homes are being managed by the federal government through a partnership with CVS and Walgreens. Vaccines used in our long-term care will come from the state's allotment of vaccine. The federal government will determine the number of COVID vaccines each state will receive. The amount of vaccine sent to the states will be based on the size of our state's population. The state will then tell the federal government or the CDC where to send the vaccine, and the federal government works with the manufacturer or the distributor to place the order. Then the manufacturer or distributor ships the vaccine directly to the providers. We've been told that if the Pfizer vaccine is authorized this month, we will likely receive a first shipment of about 85,000 doses, possibly as early as mid-December. We expect that more vaccines will then be shipped every single week. We hope that by early 2021, that health departments and community health centers will start vaccinating other adults who are at high risk for complications, meaning they have 2 or more chronic conditions identified by the CDC and who are at higher risk for exposure. While clinical trials are showing safety and effectiveness for adults, children will not initially receive vaccines, as these clinical trials with children are needed to assure the safety and effectiveness. Okay, I know that was a lot of information, so let me recap a bit. First, COVID-19 vaccines must go through and pass clinical trials like any other drug or vaccine. Pfizer and Moderna did recruit people from historically marginalized populations to participate in their clinical trials. The vaccine authorization process is independent and transparent. There is no COVID virus in these vaccines. Supplies of the vaccine will be very limited at first, and these initial supplies will go to long-term care staff and residents and a limited number of hospitals to vaccinate healthcare workers at high risk of exposure to COVID-19. Again, those who are caring for or cleaning the areas used by patients with COVID-19. We at the state have been hard at work preparing for this moment, but this is a big. We know there will be bumps in the road administering a vaccination program of this scale. States will need federal support and federal dollars as they undertake such an unprecedented effort. As I said earlier this week, having a safe vaccine within reach is an extraordinary scientific achievement, but it's not a quick fix. It will take several months to have enough supplies that anyone can readily get a vaccine. Until most people are vaccinated, the 3 W's remain our best tool to protect our loved ones, to make sure our hospitals are there for those who need them, and to save lives. Wear a mask, wait 6 feet apart, and wash your hands. Wear, wait, and wash. With that, I will turn over to your questions.